Hi guys, and welcome to my vlog on skills and capacities in the weight room. Before starting the analysis, it's important to establish the main differences between skills and capacities. Skills can be learned and improved through use of effective coaching cues and alterations in technique. An athlete may have the potential to perform a movement correctly, but is inhibited due to either a lack of motor control or unfamiliarity with a particular movement. A limitation due to capacity may include a lack of strength, imbalances around joint and muscle complexes, and also a lack of mobility and/or stability. To that end, this presentation will look to compare athletes and movements who either lack the skill or the capacity to perform a movement. Firstly, we'll be looking at the barbell deadlift performed suboptimally due to a lack of capacity. Here we can see the athlete perform the movement, but without achieving the correct lumbar posture due to a lack of hip mobility. In between repetitions, the athlete attempts to arrange his spine into the correct posture, which suggests this is not a motor control issue. The use of these quadruped exercises illustrate further that the athlete demonstrates sufficient motor control around the lumbopelvic hip complex and thoracic spine. Furthermore, the athlete shows he can also maintain a neutral spine throughout a hinge pattern as shown by this broomstick hinge exercise. With this in mind, the aim will be to improve hip mobility to achieve the correct back posture. This should therefore reduce shear forces on the spine and improve the force transmission through the knee and hip extensors. As well as being a good exercise to cue the athlete to push the hips back, this kneeling hip hinge highlights the lack of mobility around the hip complex. This quadruped rock back drill further shows the lack of mobility, but is also useful for the athlete when trying to establish the ideal foot width whilst maintaining the correct back posture. In order to improve this athlete's hip mobility, drills including Spider-Man, kneeling hip stretches, and glute stretches can be used to improve the quality of the tissues around the hip. Moving back to the barbell, it might be appropriate to regress this exercise and ask the athlete to pull from blocks. This will enable the athlete to establish the stability required at the start of each rep, whilst assuming the correct posture. As the athlete's form improves, the box can be lowered until lifting fully from the floor. As we can see, the athlete finds a much better posture with the barbell slightly elevated. This comparison further highlights that the use of blocks is a suitable constraint to achieve the desired movement pattern. If the athlete continues to struggle with a conventional barbell deadlift, a sumo deadlift may be a good alternative when aiming to load the hinge pattern with this athlete, as it requires less mechanical work and less hip flexion. Moving on, the next athlete shows limitations when executing the barbell deadlift due to a lack of skill. Here we see the athlete using a suboptimal movement pattern to pull the barbell from the floor. The athlete lacks the motor control to arrange the spine correctly and safely in order to execute the skill, as we see high levels of lumbar flexion and a degree of thoracic kyphosis. Furthermore, the barbell is placed in a disadvantageous position on the floor, that being away from the midline of the foot. This leads the athlete's centre of mass to be displaced anteriorly relative to his base of support. This in turn places undue stress on the spinal stabilizers and limits the force transmission through the prime movers. To that end, the aims will be firstly to regress the hinge pattern in order to familiarise the athlete with the correct motor control required. Secondly, to establish the correct foot position relative to the bar so that the athlete's centre of mass is over his base of support. Firstly, establishing control of the spine can be done through use of this quadruped extension and flexion exercise, as well as this standing pelvic control exercise. Moving on to the hinge itself, this kneeling banded hip hinge helps to guide the athlete through the correct range of motion. Cues such as push the hips back may be useful here. We can then look to progress the hinge to a standing position, and the use of a broomstick to maintain a neutral spine gives the athlete good feedback, keeping points of contact at the head, mid-back, and sacrum. To encourage the athlete to retract their scapula, we can move the broomstick to this position behind the back, with the palms facing forwards. This constraint demands thoracic extension and helps the athlete identify with this posture throughout the hip hinge. All these drills reinforce the theory that this is a skill issue and not a capacity issue, as the athlete displays good movement around the spine and hip. In an attempt to introduce load with the athlete, this dumbbell Romanian deadlift can be used. Cues such as shoulders back or pinch the scapula help to encourage scapular retraction. Bearing in mind that the skills and capacities are not separate of one another, This exercise may also be used to strengthen the scapular retractors should they be too weak to achieve the correct posture when under load. To establish the correct relationship between the athlete's centre of mass and base of support, using a dumbbell deadlift from the floor works well to establish the correct positioning. Cueing the athlete to sit back and pull the weight towards them ensure the weight remains within their base of support, simultaneously keeping a neutral spine throughout the pattern. Now when we've moved the athlete back onto the barbell, we can see a much stronger movement pattern. Cues such as drag the bar up the legs and push the feet through the floor encourage the athlete to keep the centre of mass within the base of support and also to maintain a strong back posture. This then helps to improve force transmission and reduce shear forces on the spine. Moving on to the back squat, we will first look at limitations due to a lack of capacity. As we view the athlete from the sagittal plane, we can see a degree of anterior trunk lean and a suboptimal bar path, which moves forwards instead of vertically straight down. This is most likely caused by a lack of ankle dorsiflexion, with the anterior trunk lean being the compensatory movement pattern used by the athlete to try and achieve adequate depth. As the athlete tries to maintain balance, we see the heels raised from the floor in order to try and keep the centre of mass within the base of support. Coupled with this, from the frontal plane we see a lack of knee stability due to a lack of force capacity from the gluteals. The knee valgus display is most likely due to the lack of recruitment from the glute medius, however improving glute strength in general should be considered. With these factors in mind, the aim will be to improve ankle dorsiflexion as well as the force capacity of the gluteal muscles. Here the athlete displays relatively good hip mobility, however, when looking at the ankle we can see a limited range of movement. In order to improve this, ankle mobility and strengthening complexes can be used to increase the movement available to the athlete. Such exercises may include foam rolling, calf raises, and numerous other ankle mobility drills. In an attempt to increase the strength of the glute muscles, a combination of multiplanar, unilateral and bilateral exercises may be used. Exercises including banded walks, glute bridges, banded prisoner squats, and split squats will help to strengthen the muscles required in stabilising the knee joint throughout the squat movement. The use of the band helps cue the athlete to keep the knees out, ensuring good recruitment of the hip external rotators. The final example shows an athlete limited in the back squat due to a lack of skill. Here the limitation is more due to the technique employed by the athlete rather than the motor control. The only cues given to the athlete were to squat down as low as possible while maintaining balance at a controlled velocity. It's clear that the narrow stance width is inhibiting the range of motion available at the hip. Fortunately, the athlete displays good ankle mobility, which compensates for this as the athlete still hits parallel. Another consequence of the narrow stance used by the athlete is the large amount of lumbar flexion. The athlete fails to keep the head and chest up, resulting in an anterior bar path. To that end, the aim will be to identify the most comfortable stance width for the athlete, as well as using drills to try and maintain a neutral spine with the head and chest up. Using this quadruped exercise shows a good amount of hip flexion available before any tucking eventually occurs. Adjusting the foot width during this exercise is a good method to identify a comfortable stance width for the athlete, as it allows for more hip flexion due to increased hip external rotation. This supine hip flexion exercise and kneeling ankle mobility assessment show good ranges of motion and strengthen the notion that this is a skill issue and not a capacity issue. Using this counterbalance squat to a box helps the athlete familiarise himself with the bottom of the hole. Utilising a wider stance with the toes turned to a 5 past 11 position allows for greater hip mobility. Thus, the athlete can squat deeper whilst maintaining a neutral spine. Cueing the athlete to sit back and keep the head and chest up can be reinforced by use of this pole squat. Asking the athlete to sit back into the heels further helps keep the centre of mass over the base of support. To further reinforce keeping the chest up, moving the load to an anterior position demands more from the core stabilisers and upper back muscles to maintain the correct posture. Using a goblet squat is a good tool to reintroduce load to the movement now the appropriate stance width has been established.